CPE originated in the States as an effort to provide students within theological training the experience of actually interacting with others to better learn who they are and what it means to provide spiritual care. So students were invited into the clinical context to engage with living human documents. In other words, real people in their lives and their stories, in an effort to learn what it is to provide spiritual care. In this modern context today, in Canada, the Canadian Association for Spiritual Care, l'Association canadienne de soins spirituels, also known as CASC, is the body that trains and certifies professionals in this field. And they do so through Supervised Psychospiritual Education, which was formerly known as Supervised Pastoral Education. Within CASC, there are two streams of education that both fall under the umbrella of what is called Supervised Psychospiritual Education. These two streams are CPE and PTE. CPE stands for Clinical Psychospiritual Education, however was formerly known as Clinical Pastoral Education. CPE is a stream that is focused on the context of the institutional setting. For example, a healthcare setting such as St. Joseph's Hospital, or parish ministry, prison ministry, or university contexts, just to name a few. All of these different institutional settings are geared around meeting the patient or person wherever they are at and providing care for them in that context. PTE, or Psychospiritual Therapy Education, formerly PCE, Pastoral Counseling Education, on the other hand, uses many of the same skills and the same foundations, but is geared towards preparing people to work within private practice. This is where people or clients are coming out of their regular contexts to meet with an intentionality around a specific area that they would like to receive care or counseling for. Here at St. Joseph's, we have specialized in offering CPE, or Clinical Psychospiritual Education. This is because we align ourselves within the context of a healthcare institution. Regardless of which stream you're in, SPE is an evidence-based learning approach which combines qualified supervision with group reflection and embedded clinical practice. There are two levels within each SPE stream, the basic and the advanced levels. Basic education tends to focus more on self-awareness and understanding oneself as you interact within the therapeutic relationship. This will involve learning some fundamental foundational psychotherapeutic skills. It will also involve learning how to incorporate these skills and make use of other skills, such as theological reflection and spiritual practices, and how to integrate all of these together into the practice of meeting and caring for others. At the advanced level, we look then to broaden and deepen the skills that are developed in the foundations of a basic unit, and grow these such that we can develop confidence as spiritual care practitioners. Regardless of whether you engage at the CPE stream or the PTE stream, both streams work from the same set of competencies, and these competencies can be found on the Canadian Association for Spiritual Care's website, spiritualcare.ca. Although not everyone who takes a CPE or a PTE course is moving towards certification within the Canadian Association for Spiritual Care, some are interested in this, and so I'll briefly review the process. Similarly to there being two streams in SPE education, there are two certifications as well. There is the certification of a spiritual care practitioner and that of the the certified psychospiritual therapist. Typically, taking units of CPE will lead to certification as a spiritual care practitioner, and taking units of PTE leads to becoming certified as a psychospiritual therapist. Regardless of which certification process you may be moving towards, the path is generally the same. Typically, you would start with applying for that first unit of SPE, and that would involve then completing 2 units at the basic level. And then there's an application process to move into advanced, completing 2 units at that advanced level of training. Then there's the accumulation of individual independent practice hours. These are typically supervised by a mentor. And then once those hours have been accumulated and the appropriate documents have been gathered and composed, there's an application for certification process. which culminates in certification. At its fastest process, to complete all of the units and then move towards certification, you might be looking at 2.5 years, but there's no time restraints on how long you have to, or how quickly you have to move through this process. One of the unique features of clinical psychospiritual education is it is such an experiential approach to learning. Essentially, you are invited into a care team and you become part of that care team as you provide support and spiritual care to patients within the hospital setting here at St. Joseph's Healthcare. You, of course, do this with the supervision and support of a certified supervisor educator. You are not alone in doing this work, but you certainly are the face of spiritual care in the teams that you are assigned for the duration of your placement. And as you immerse yourself in this learning environment and are engaging in the various assignments to support the learning, you will discover some learning edges that maybe you want to explore further, opportunities where you want to grow and develop while you are working towards engaging the various competencies set out by the Canadian Association for Spiritual Care. As you can see on this slide, the structure of the course is about 50% clinical engagement, where you are doing the work of providing spiritual care to patients. You are working alongside an interdisciplinary team, which might include people such as a social worker, nurses, physicians, and other various therapists of various sorts. And you are part of that team in trying to develop the best care plans for the patients that are in your assigned care areas. The other 50% of the course is spent in group process and didactic learning. This is where you'll have the opportunity to prepare reports, such as verbatims, where you then share with your supervisor and peer group about an experience that you had in the clinical context. And you're able to get valuable feedback around what you felt worked well, what you felt maybe could have been done differently. And this input from your peers and supervisors is helpful then in supporting your growth as you continue to reflect on what took place in that interaction and where you can continue to grow as a result of the reflective exercises. CPE also provides unique opportunities through the peer group to work on giving and receiving feedback, being able to see almost as though in a mirror how your care is received and how you as a person impact others. We explore through the CPE experience the concept of safe and effective use of self, how we make use of ourselves within the therapeutic relationships, and do so in ways that protects those we are engaging as well as ourselves. We also have didactic sessions in which we have specialists from the clinical contexts come and provide specialized education around specific theories or topics. Didactics might be context specific. For example, in the context of long-term care, there may be sessions on grief and how to support people dying. In mental health, there may be didactics around stigma of mental health and how to manage this while providing care for patients here. Other didactics are more theoretical based and are drawing on the expertise of different disciplines. All of the didactics are provided by people, specialists, who are working day to day in the clinical context. Hence, there are some real unique opportunities to learn from a variety of specialists. Finally, there is also individual supervision, where either weekly or bi-weekly, depending on whether you're in an intensive or extended program, you will have the opportunity to meet one-on-one with your supervisor and explore with them a variety of subjects and themes, largely of your own choosing. COPE presents a cycle of learning that describes an action-reflection integration model where we derive our learning from experiences and from reflecting on experiences. This kind of model drives the learning within the context of CPE, where you have some sort of concrete experience, usually within your clinical context, and then you begin the process of reflecting on that experience. Within the context of CPE, you're invited to bring this reflection to your peer group as they will support you along with your supervisor, using tools such as verbatims or case study to really deepen that stage of reflection and to explore the possibilities of abstract conceptualization. As you explore these experiences with your peers and supervisors, you have the opportunity to see them differently and perhaps gain new insights or new awareness, and to wonder about the possible alternative ways of being, Then you will be provided with the context in which to experiment with these new insights, such that you can then bring them back into the clinical setting and try something new, something different, and see where that takes you. See what lands, what doesn't, and offering you, again, the opportunity to begin the stage of reflection. As you go around the cycle and have these new experiences, you will begin to integrate the learning, and it becomes part of your growth and transformation. Kolb defines learning as a process whereby knowledge is created through transformation of experience. We have done research with students who have previously taken these units with us, and they have told us that CPE is a transformational learning process in which they learn both about themselves as well about a plethora of other skills and experiences they can take with them into different contexts and environments and continue to learn. In some ways, not only are you learning the skills relevant to the context here, but you are also learning how to learn through this model that can serve you wherever you go, whatever you do. Another key feature of clinical psychospiritual education is that it is an adult learning model. We use an andragogical approach to learning when we engage in clinical psychospiritual education, and this is founded on 6 key principles. First, when adults are motivated intrinsically to learn, they tend to learn more and be more invested in the learning process. Adults are interested in understanding why they need to know what they need to know. We don't just assume something is important, but we need to understand why it is important. Secondly, as adults, we also have a need to be self-directed and responsible for our own learning. So in the context of clinical psychospiritual education, this will mean that you will bring goals to this experience that you will be pursuing alongside those of the competencies set out by the CASC. You will be directing your own learning, and the more you give to this learning experience, the more you will get out of it. Again and again, we have had students testify to this truth. Third, we also recognize that you will be bringing with you experience, both prior to CPE as well as those experiences gained through CPE, and these experiences will point to new learnings. You may find in the context of your clinical assignments that there may be some skills that you need to develop in order to function as a spiritual care provider in the space assigned. And so you will use that gap to then lead you or guide you in the learning that you need to acquire. But you will also then be responsible for your own learning to ensure that you are asking for the support that you need, such that you will be getting from this learning experience all that you want from it. But we recognize you do not come to this experience as a blank slate, of course. We value all experience and knowledge that students bring with them into the learning environment. It is these unique experiences and knowledge that we can each bring that can help foster this wonderful, creative, dynamic group process in which we all learn and all benefit from having the voice of others contributing. Fourth, adults tend to learn better when they're ready to learn, when they experience a need to know. So it is that gap, when you find yourself needing to grow because practice demands it, that you are more likely to engage in the learning. Fifth, learning is also easier for adults when it's concrete and attached to a task or problem. That it's not just abstract learning for the sake of learning, but here's how it connects with life, here's why it matters, and here's the way you can engage and really practice it. This particular aspect of the learning model really drives the placement of our didactic teachings, the hope being that you may learn something and then immediately take it into the clinical context to practice and apply it. Sixth, with an andragogical approach, adults also tend to be more internally motivated than externally motivated. You will get more out of this if you have that intrinsic motivation to do something than if you are waiting for someone to direct you and say that you must do this, that you must get through this. Obviously, both are viable motivations during CPE, but if you can find that internal piece that you want to gain from this experience, you are certainly more likely to gain a whole lot more from the experience. As educators, we are keeping all of this in mind as we formulate a CPE course. Yes, we have structure that we adhere to, and yes, we have competencies that we are teaching to, but we are trying to tailor all of these pieces to what your learning needs are, what your goals are, such that we can have 6 students with 6 goals, all unique and all unique experiences. And at the end of the course, each student can come out feeling as though they have endeavored to learn whatever they needed to learn from this experience. It really is a very rich process. CPE courses across Canada are offered in 2 formats, intensive and extended. At St. Joseph's Healthcare, we run our intensive CPE courses in the spring term. These are 12-week courses that start around the beginning of May and run through until the end of July. And the expectation is that you are present Monday through Friday, 8 a.m. till 4 p.m., either virtually or on site as directed by your supervisor educator. With this intensive model, there is no on-call and there are no weekends, but you are engaged full-time, and then we'll have some assignments that you will be completing in the evenings. It is a very full 12 weeks of robust, intense learning. Our extended units, on the other hand, are offered through the fall-winter terms. We usually begin the weekend or the week after Labor Day in September and run through until April. This is approximately a 30-week course where you would be on site with your peer group 2 days a week. For those 2 days, you're on site between 8 a.m. and 4 p.m. And again, there is no call and there are no weekends. We usually offer at least 1 intensive and 1 extended course each year here at St. Joseph's, assuming there is sufficient interest, as we are required by the Canadian Association for Spiritual Care's standards to have a minimum of 3 students for a unit to be considered viable. All of our courses are provided by supervisor educators who are certified through the Canadian Association for Spiritual Care, and all of our educators are also registered psychotherapists through the College of Registered Psychotherapists in Ontario. As a result, at the end of your course, you will be given both certificates of completion of the CPE course from CASC, as well as your documents to direct client contact hours and attestation for supervision hours for the College of Registered Psychotherapists in Ontario, whether you intend to apply to the college or pursue certification through CASC or not. Our program is accredited through the Canadian Association for Spiritual Care, and this is renewed every 5 years. St. Joseph's Healthcare is owned and operated by the St. Joseph's Healthcare Society, and we are a family of sites that includes St. Joseph's Hospital, Parkwood Institute, Mount Hope Centre for Long-Term Care, and the Southwest Centre for Forensic Mental Health. Within these facilities, our spiritual care services encompass rehabilitation, acute ambulatory care, surgical care, specialized mental health care, which includes both forensic mental health care as well as traditional mental health services, long-term care, specialized geriatric care, veterans care, complex care, palliative care, and a number of specialized outpatient clinics that support a wide variety of chronic disease and medical services. We have supervisor educators who are trained to be able to provide CPE units across all of our different sites, providing a good variety of opportunities for learning, depending on what goals students are coming into the program with. As we look to place students in our centers, we certainly keep in mind which of these contexts would best support learning goals and the students' learning and growth. Our spiritual care team is larger than the team of educators, and they come from diverse faith backgrounds and collaborate with the spiritual care students as opportunities allow across the various sites in our system. And together we get to discover with our students what it means to be dedicated team that supports those in our care while living with illness and injury. Here at St. Joseph's, we welcome CPE applications from those of any worldview or faith affiliation. We do require that students be either registered within a master's degree program at a seminary or alternatively have at minimum a bachelor's degree with at least a 6.0 grade point average. To apply for our spring intensive units, we ask that you please submit a completed application package by December 31st each year. And for our fall winter extended units, please apply by April 15th. Late applications will only be considered if space remains available with any given course. If you are interested in either applying or learning more about the application process or CPE in general, please feel welcome to contact one of our supervisor educators, Stephen Yeo, who practices down at the Southwest Center for Forensic Mental Health Care. Once you have submitted a completed application package, which will include the completed application form complete with long form answers, an unofficial transcript, a resume or CV, and 3 completed reference forms, you will be contacted to schedule an interview. The interview usually takes place between 30 and 60 minutes and makes use of a standardized set of questions. All applicants will receive a letter informing them if they have been either accepted or otherwise. If you are not accepted, please do not take this personally. There's a lot to consider in the creation of a CPE cohort, and each course is capped at 6 students. Students are always welcome to reapply for subsequent units. If you are offered a place in a CPE course, you will be instructed in registering for the course through your seminary, as well as completing all of St. Joseph's pre-placement requirements, which will include completing a vulnerable sectors check, a health review form, and multiple e-learning modules, as well as registering as a student member in the Canadian Association for Spiritual Care.